that seeks to introduce mandatory COVID-19 vaccination and fines of up to 4 million shillings or jail term of 6 months is what we are discussing this morning. My name is Shivana, and joining me, of course, to, give us more insight in regard to this conversation and help us understand the genesis of this amendment and help us also understand how best will this actually be effective in Uganda is none other than Odira Nansamba, and she's the Public Relations Officer that is the Ministry of Health. Good morning, madam, and thank you for joining us this morning.
Thank you, Shivan, for having me.
Yes.
I'm glad to be here.
We're very excited and we're glad that you made time to join us this morning. And we talk issues of health because health is, when it comes to things of health, it is everyone wants to be okay, everyone wants to be lively, everyone wants to be as healthy as possible. So when you come this morning to talk about issues of health and things that are even in regard to human rights and consent, then you're definitely, doing a service to the nation. However, let's dive right into the conversation. So what are some of the key proposals that have been made in the bill?
So the key proposals that are made in the bill are not necessarily zeroed down to COVID-19 vaccination, but immunization in general, because we have the routine immunization for children that are below 5 years, but we also have immunization that comes in once in a while when there's an outbreak, like we recently had the one for measles and rubella. So we always have those exercises of immunization as advised by World Health Organization. So these amendments are looking at all these forms of immunization, but in particular, of course, is of outbreaks, diseases that are highly infectious. And that doesn't only still zero down to COVID-19, but just in case Ebola gets a vaccine, and we are able to access it as a country, then it would also fall within that category because it is also highly infectious. So it is quite broad and not very specific to COVID-19, because just in case COVID-19 is cleared in a year or two, still the law will be in place and will be enforced in case it is needed to be enforced.
Okay, so now with that all said and done, what is the motive behind all these amendments?
The motive is that the background, the genesis of this is that we have seen a lot of hesitation as far as vaccination is concerned. I'm sure you know that in January we had mass vaccination for polio for children, and we witnessed a situation where parents were literally hiding children from getting the vaccine. And this is meant to protect their children from the disease. So and then when it also came to COVID, we saw people very hesitant. Of course, we can't blame it on them entirely because we did not get the vaccines, all the vaccines that were required to vaccinate everyone in time. And they were coming in slowly and we were only taking on priority groups. But there's always misinformation that people get from social media, from the internet, which is not verifiable, and they tend to take it as gospel truth against what we tell them, that the vaccines are safe and efficacious. So because of that, they are hesitant, because if they tell you that if you take this vaccine, you will not be able to have children, and you don't have any children and you want to have some, then you'll be hesitant. You're like, no, I would rather not take it and go the other way of probably getting sick, and whatever will happen will happen. So it is a duty is upon us that we continue to educate the masses about this, but we also have to know that the disease is very infectious and you don't know how it will react in your body once you get it.
Okay.
Yeah, so we have to make sure that people get vaccinated.
I understand where you're coming from, but looking at some of the tweets and the conversations that were coming in, for example, this tweet from Ainebiona Dos, and he said, this bill is going to be the worst. Something to do with health should be a person's right and human right. However, the question would be, have you done enough background research to understand why is it that Ugandans are shunning some of these vaccines? You yourself have mentioned that some parents were even going to the extent of hiding their children from getting vaccinated. So the question is, has enough sensitization and assessment been done to understand the genesis of this issue?
We have. We have done the research, and it is globally understood that vaccination has never been accepted that easily. That's why even the Baganda had a very good name for it, Okugema. meaning you cannot accept it easily. They have to force you to get to take the vaccine. So it is not a Ugandan problem alone. It's a global question. It is a global problem, and each country puts up measures that they feel will be suitable for their people. I'll give an example. Recently, a friend of mine was in Australia, and she had gone with her vaccination card, but for some reason it wasn't scanning, and she couldn't attend the workshop that she had gone for because you must have a vaccination certificate.
Yes.
Some restaurants, she was stopped from going to certain restaurants because she did not, her certificate couldn't be scanned. So she had to get back to us and request, can you please check why is my card, my certificate not being scanned? And we had to go through a whole process and get for her another one that is scannable. So those are some of the measures that certain countries put in place to ensure that their publics are safe. So if you need, for Uganda, we know that such measures might not apply to our public, knowing who they are. But we know that if we have a law in place, people will respond. Okay. Like, for example, in this bill, there's a section where the school proprietors are going to be held liable if they allow children to be admitted in their schools and they haven't been fully vaccinated. Because we know by 1 year a child should be fully vaccinated. So if your child has turned 3 years and is going to nursery school and they haven't been fully vaccinated, then that means you intentionally refuse to take these children for vaccine. Remember, these vaccines are freely available. Government spends a lot of money to buy these vaccines. So you as a parent, it's your responsibility also to take your child and protect them against these diseases. And remember, you're also protecting other people's children, because these diseases they can easily spread to other children. So there's going to be, the proprietors of schools are going to be held liable, not only the parents, but also the school proprietors.
Okay, so agreed that these vaccines are available. Now let's look at a case scenario of people that are living in rural areas. Are they accessible? Even while a vaccine may be available, is it accessible as well?
Thank you very much for that question. So since November last year, we had enough vaccines for everyone aged 18 years and above. And the ministry came up with a strategy which we call accelerated mass vaccination. We have been doing it regionally, and so far we have covered all regions. We are only left with Bunyoro, which should be starting in a few weeks to come. And what we do, we ensure that vaccines are placed in every village. We have teams in every village that are vaccinating people, because we realize that the main people that we want to get these vaccines are the elderly, because they are the ones that get affected by the disease most. But they are unable to reach to where the health centers are. In some places, it is about 5 kilometers away. So it is hard for them to walk to those places for the vaccine. If they manage to get the first dose, sometimes they don't go back for the second dose. So we agreed that if we put in every village an immunization point, then they will be able to walk to that point and get vaccinated. So right now, the question of access is no longer applicable in Uganda. Okay. The vaccines are available in every health center, up to health center 3.
Amazing.
In this country. And then we also have those outreaches that go up to the village level. So we are saying the vaccines are available. We have brought them closer to you in your village. Why are you not taking your jab?
Prior to these amendments that, we're putting forward to amend when it comes to the Public Health Amendment Bill, has sensitization been done fully?
Well, sensitization for immunization has always been done. When you're expecting a baby, when you go for antenatal, these are some of the things they tell you about. There's a vaccine that you take before you give birth, when you're pregnant, and then when you give birth, they immunize your baby when you're still in the hospital, and they tell you have to come back after 1 month. So the sensitization has been there, especially with the mothers, because in Uganda, we know from research, it is the mothers that are almost 95% of them responsible for the health of their children. So they have fully been informed about the immunization. Okay. And the sensitization has been going on even for COVID-19 vaccination. We have seen even the private sector come in to support us with sensitization of the masses. I mean, everyone knows. They know even the different types of vaccines that we have. That's why some of them claim, no, me, I want Johnson & Johnson. Others, I want Pfizer. So it has gone beyond just knowing that the vaccines are there, but they know even the types that are available.
Okay.
So that has been fully done. But we continue. We cannot stop. We have to continue because there's a group of anti-vax community that keeps pushing, trying to influence people to instill fear in them not to come for vaccines. So we also have to put in enough effort to counteract whatever misinformation is being shared. Okay. It is unfortunate that most of this information is shared on social media, and the young people who were vaccinated are the ones that are picking this information and misinforming their elderly people in the villages that, you know, don't take this vaccine, it will kill you, you know? And it is very unfortunate because so far the statistics we have of people that have been affected by COVID-19 show that the majority of the people that get severe illness with COVID-19 are the elderly. And right now it shows that those that have become severe with COVID-19 and even died, especially in the third wave, are those who have not been vaccinated or have only taken one jab.
One jab. Now, allow me to ask this. When this particular proposal was brought to table, you know, to amend the public health bill, very many mixed reactions were on social media and on Twitter. And yes, according to Section 10 of the Human Rights Act of 2004 says that no one may be subjected to medical or scientific experimentation or treatment without his free or fair consent. And people have come out to argue that it is their right to choose whether they should get vaccinated or not. So why is the ministry coming ahead to say that it shall now be mandatory? Either you will be fined or you will be charged. What is your take on that?
So this is not a trial. Vaccination is not a trial. Their right is giving consent to something that is still being tried and has not been approved for use in humans. But these vaccines were tried already and approved by World Health Organization to be used on humans, and they are being used globally. So the question of it is my right, I have to choose whether I should get vaccinated or not, in this case does not apply.
Okay.
Yeah, so it is a misinterpretation of the law.
Of the law.
Yes.
I understand. So is there a particular type of vaccine being pushed, or is it just all vaccines in general?
It is all vaccines for adults and for children. But in this case, this law will apply to the vaccines which the government has clearly announced that everyone should go and get this vaccine. Like, for example, there are some vaccines in this country which are paid for. Like, for example, if you want to vaccinate your child against pneumonia, there's a pneumococcal vaccine. It is there, very effective, very good for children, but the government has not yet put it in its routine vaccination plan. So unless it is put in that plan, then it is not enforced by this law. So it has to be put in the plan and communicated to the public very well that you should go get vaccinated, because they have to be informed. If you come to arrest me that I haven't been vaccinated and yet I clearly don't have any idea about the vaccination process, then it would be unfair. So the public has to be informed ahead of time about the vaccination, and there has to be evidence that they were informed, and then you can now enforce the law.
But still, looking at some of the responses that have been coming from social media and the public in general, many are still saying that this move is basically to force people to get vaccinated for COVID-19. Has this been said and passed? Because yes, you might say we're looking at getting vaccinated for all other infectious diseases, but a certain category of people feel like the ministry is only actually pushing the agenda of getting vaccinated for COVID-19.
We know that right now we are fighting a pandemic.
Yes.
Which is COVID-19, and it is a global pandemic.
Absolutely.
And we have seen that it keeps mutating itself, bringing new variants. You can't know when the fourth wave is going to come and how bad it's going to be. We have been lucky that Omicron came and it was a little bit mild, not compared to Delta that we had in the second wave. But just imagine if it was as ruthless as Delta was, how many people would have died? And yet there has been an opportunity to protect yourself against the disease, against severe illness. By getting vaccinated, the vaccines are available. Why don't you protect yourself? Because you never know, another wave will hit. It is still a pandemic. World Health Organization has not yet declared that it's no longer a global pandemic. It is still a global pandemic, and we keep preparing ourselves. We know that we have to make sure that prevention becomes our key message, because if everyone falls sick and they all want to go to the hospital, we don't have enough manpower to take care of everyone. The resources might not be enough to take care of everyone if we all fall sick and reach the level of getting hospitalized. Okay. You witnessed it in the second wave. Everyone would be calling, looking for a bed. They want admissions. People were being, getting treatment in ambulances. It was so bad. We don't want to see ourselves get back to that level. And yet we see in developed countries where they had the vaccine much earlier than us, it is working. People who are vaccinated, yes, they fall sick, but they don't reach the level of needing to be hospitalized. Okay. So we really need to build that same herd immunity in our community, and it has to be through vaccination. So if they are tagging this bill to COVID-19 vaccination, well, yeah, it could be. It is. Because right now, our major effort is on having everyone get vaccinated against COVID-19. But there are other issues that we are cleaning out of this bill, because there are certain roles that have become obsolete. Like, in the past we used to have health inspectors. Yes. They are no longer there. So we have to replace those with the current roles that are in government structures. We have KCCA that is very pivotal when it comes to healthcare within the capital city, and it is not captured in the old law. So we need to have them captured, because they play a critical role as far as public health is concerned, especially in the city.
So looking at among the amendments that are to be included in this bill, I mean, we're looking at some of the consequences when you're found that you're not vaccinated. We're looking at the parents, we have the school administrators, but also we're looking at individual basis, and the fines are fines of up to 4 million Ugandan shillings, or even 6 months imprisonment. Don't you think that is a bit too harsh?
I think it's not. Okay. It's not so harsh. Looking at the economy, because the previous the law being amended initially, it had 150,000 as a fine. Right now, maybe by the time they created the law, 150,000 was a lot of money that people would find hard to break the law, because it would be expensive for them to pay. But right now, 150,000 is nothing. Anyone you tell them pay 150, they'll just pull it out and pay, and they will not go and get vaccinated. But if you tell them you pay 4 million or you go in prison for 6 months, then they will have to heed. It has to be a little bit harsh for people to respond. Mm-hmm. Yeah, if we keep it lenient, then they'll say, no problem, I'll just part with that, 1 million and I move on. Yeah, then it would have beat our own, goal. We cannot meet our goal if we make it so lenient for them.
So how do you plan on identifying the unvaccinated? I mean, there are people who do not move around with their vaccination cards. There are those who get vaccinated and even lose their vaccination cards. So how are you planning to identify, this one got the jab, this one did not get the jab? Okay, so the vaccination card is good, but this, the data, we have all the people that are vaccinated, we have their data. Okay. We have a database with everyone, and that's how they're able to generate their certificates. So by the time this law, if God willing, passes in Parliament and gets gazetted and is to be enforced, we hope that every Ugandan will be vaccinated, because our target is that by the end of this year, at least we should have 22 million Ugandans fully vaccinated. Okay. So we hope that by the end of this year, everyone will be vaccinated and fully vaccinated, and will be having their data on the online, so that wherever you'll be, even if it is at the bus park, the conductor will be able to go on the Ministry of Health website, enter your names or your national ID number, and it brings the data showing that you're vaccinated. If it's not there, then that means you're not vaccinated. Well, let us hope that we also do not get to pay the 4 million shillings, or do not end up in jail. However, as we wind up this conversation, what message, and I'll give you the opportunity to speak to someone who is watching us this morning, what message do you have to those who have already a negative conception or misconception about these proposed amendments?
I would like to call upon the Ugandans out there that please come out and get vaccinated when the opportunity is still there. The government has endeavored to make sure that we have access to vaccines, different types of vaccines, but they are all safe. They have all been approved by World Health Organization, and they are all effective. So please go get vaccinated. You don't need to wait for the long arm of the law to catch up with you. It doesn't have to go that far.
Yeah.
Let's just get vaccinated. These are our lives. We all want to be alive. When COVID-19 was first announced and we were seeing people in the West who have the best healthcare services dying the way they were dying, we didn't know that we would, as Africans, would live up to see today. But we are grateful that at least now there's a way we can protect ourselves. So let's go get vaccinated. All health centers, all government health centers, up to health centers 3, have the vaccines available. Go get your vaccine. If your second jab vaccine is not there, there's a way the Ministry of Health has guided all health workers on how to mix the vaccines. So if you took Pfizer for your first jab, and now at the health center Pfizer is not there, you can take AstraZeneca. So that shouldn't be an excuse for you not to get fully vaccinated.
Okay.
So our message still remains, please go get vaccinated.
Just one last one. What makes this the appropriate time for some of these amendments to be made now?
It is very appropriate, as you had mentioned, because we are fighting a pandemic, as I had earlier mentioned.
Yes.
We are fighting a pandemic, and the government is losing a lot of money through the lockdowns. And everyone is tired of lockdowns. The children have just returned back to school. We don't want for them to be, after like 2 or 3 more months, and then the government says, no, the infection rates have gone high, please go back home. The infection rates might increase, but if the level of hospitalization is low, and that is our target, then the economy will still remain open. So we all have to join hands, work together, and ensure that everyone gets vaccinated.
Okay.
Yes.
So if a child is got in school, yes, I know that among the sanctions is that the school administrators are held liable, and the parent and the teacher. So if a child is got in school and they're not vaccinated, does the ministry penalize all of them at once?
All the children?
The teachers, including, and the
no,
parents as well?
it is the proprietor of the school, the head of the school, because they are the ones that ensure that the law is enforced within their school. If the Minister of Health says, before you admit a child, they should bring their vaccination card. You should see that they are fully vaccinated. If they are not fully vaccinated, ask them to go and get the vaccine.
Okay.
So if you don't fulfill that, and you allow this child to be in your school when they are not fully vaccinated, then it is your responsibility as the owner of the school. Not everyone, the teachers and everyone, but the owner of the school who sets the rules that should be followed by all the parents within the school.
Well, thank you so much for joining us today, this morning, on this conversation.
Thank you so much for having me.
Well, that winds up the conversation that we had for you this morning on the Twitter jabs. I do not want Sauli de Sategede. Please go and get vaccinated for COVID-19 and all other infectious diseases, or else you might be paying a lump sum of 4 million Ugandan shillings, or even ending up in jail term for a period of 6 months. And trust me, you do not want to be found in that situation, because at the end of the day, when it comes to infectious diseases, it is a collective responsibility. If I get vaccinated and you do not get vaccinated, that means you're still going to be putting me at risk. So ladies and gentlemen, please go out, get vaccinated. These are not conspiracy theories. Get in touch with your health worker. Let them take you through the process of these vaccines. If there are side effects, they will also let you know and guide you on how best to go about it. Because at the end of the day, what we want is a healthy environment and a healthy nation at large. Otherwise, that winds up the conversation that we had for you this morning on the Twitter jabs. However, stay tuned, because we still have an amazing lineup for you this morning. We take a quick breather, but when we do return, Sandra Kopp is showing us something in regard to nail art. Ladies, stay tuned, because this is definitely very interesting.